I talk like this. Welcome to the Pearlii Podcast. All right. Thanks again for coming along to the Pearlii Show. Today we've got a special guest, Dr. Leif Svensson. Leif, thanks for joining us.
Hi, how are you? Thanks for having me.
Yeah, pretty good. Today's a pretty fun topic, one that I get asked a lot. I'm sure you do as a dentist. Can I just replace all my teeth?
So I'm a dental prosthetist. So prosthetics, anything prosthetic that goes in your mouth, that's the stuff that I make. So I actually tell my patients this quite a lot. They don't really like dentists, but I always stay friends with all of my patients. Because I don't hurt anyone. I just put things back in that they've lost before.
Okay, so what do I do if I'm getting older and I've got a lot of problems with my teeth? Can I just replace all my teeth? Is it a simple procedure? Can you walk us through it?
Sure. It's actually not that simple. And you know what? What's really interesting is I do have patients quite often come to me and go, oh, look, Leif, let's just get all my teeth taken out and just throw some false teeth in there or implants or whatever it might be. I'm always sort of shock horror when I hear that. Not just because I don't want to get sued for recommending something like that, but more so that every tooth I've calculated in their head is probably worth about $5,000. It's a free implant. And so, you know, if you want to pull them all out, that's quite an exercise. And then what are you going to do to put them back in? Look, when patients have serious problems and the teeth need to come out from an infection perspective, no problem. Sure. It's got to be done. It's better for the body's health. And it's just a good thing. But, you know, people will actually get there with a full top plate. With a full bottom plate, so let's say you're going to take out all your bottom teeth and put a bottom denture in, some people actually never get there. And so they're pulling out potentially some, if they say just take them all out, if there are some good teeth worth saving, again, I just said, look, you've got 5 good teeth there. You've got $25,000 worth of free implants, natural implants that we can grab stuff onto. So that's kind of how I explain it to them. And they typically will turn. Sometimes I've had people adamant they want all their teeth out and, well, you know what, if a dentist is prepared to do that for you, well, that's their decision. I'll make something on top for you. But certainly I would never, and dentistry these days has completely come full circle. You know, if I've got a 70 or 80-year-old patient, they've had no teeth. Literally, they took everything out at, you know, for their 18th or 21st birthday.
Wow.
But it's not like that anymore. We will just kill ourselves to save a tooth, no matter what it is. So that's how the mentality has really changed over the years.
Okay, like how far can a tooth deteriorate before you would be like, it's gone?
Yeah, so the dentist will take an X-ray, they'll see the underlying bone structures and they'll work out, look, is it worth keeping? Is it not worth keeping? But that's pretty much how they determine it. So X-ray is generally the way they'll do that.
Yep.
And they'll also be measuring the mobility. So if that tooth is wobbling around like crazy, they know that the bone has shrunk so much, the socket that basically holds it in is just shrunk away and it's basically not possible to be saved. So yeah, X-ray is generally the way that will happen.
All right. And what about the consequences if I do want to replace my teeth? And are there any differences between replacing the upper teeth and the bottom teeth? Like the pain? I know it's a big, it's painful, the cost, $5,000 per replacement of a tooth. That's insane. But what about the treatment and the recovery?
So let's say hypothetically, you're just missing one tooth. Like Kyle, I've just seen your missing tooth there. So the reason you want to actually fix that and fill that is for a couple of reasons. One, when you've got a gap with the tooth on either side, the teeth on either side have a natural tendency to make their way into that gap, which will then effectively open up gaps elsewhere, which you probably don't want. So for example, you don't want a gap in the middle potentially. Well, there are some supermodels these days that have a big gap in the middle, which is kind of cool. That's one reason. The second reason is, let's say the opposite, right? So on your gap on the bottom there, you've got a tooth up top that opposes that. So when they oppose each other, if they've got nothing to touch, they continue to grow. So, you know, you heard that saying long in the tooth.
Yep.
The tooth just continues to grow longer and longer and longer. Well, potentially, if there's nothing to stop it from continuing to grow. So that's and that can cause major issues with a person's bites, the way and all sorts of complications. So that's pretty much the reason, or that's the explanation I always give, even if you've got one tooth missing, why you should put something in that gap. And then it comes now to, well, how do you fill that gap? Well, there are a few options. One is a denture, which is what I do every day of the week. many, many different types of dentures, big, small, metal, non-metal, flexible, solid, many options. The second option is a bridge. And a bridge is basically where you'll cut the teeth on either side of the gap, and you'll have a 3-piece tooth effectively that will go into that position. Dentists are kind of starting to sway a little bit away from that these days because they don't want to cut good teeth in order to fill the gap. Anyway, in effect, that is still an option. And the third option is an implant. And obviously that's that's the best option. Not cheap, but the best option. So let's say let's say the tooth are beyond repair, right? Your top teeth are beyond repair. And okay, look, you're going to need to get a full top denture. So what does that mean? I sit the patient down and I'm so frank with them. I'm so blunt. I just say, look, this is going to be the most horrific experience of your life. It's going to be so difficult. Think about this logically. You're going to have all your teeth taken out. You're going to have these holes where the tooth came out of the socket, open wound. And then I'm going to put a block of plastic on top of the open wound. And then you're going to try to eat and you're going to bite into it. And it's going to hurt like hell. So I'm very, very, very graphic with them because I want them to understand that this is obviously it's quite a journey for them. Then, as you mentioned, or as we can talk about as well, you lose a lot of taste sensation when you start to cover your palate. So if you cover your palate with a big, 3 millimeter piece of plastic, you're going to lose taste sensation, but you're also at a risk of burning the back of your throat. So you have hot drinks, the plastic shields the hot drink as it's going down, and then boom, hits the back of your throat, and you burn yourself. So it's quite a difficult thing to get used to. The other thing is, as the gums start to heal, so you've got these little sockets where the teeth came out of, they start to close and shrink. Then the denture starts to get looser and looser and looser, and you're going to use more and more and more glue, which is disgusting in and of itself. And then at the 3-month mark, we'll do what's called a relining. So we'll basically make the denture look like it's yours, not like somebody else's. And we replace all the fitting surface and make it fit really well. So there's a very, very difficult 3-month transition period from all the teeth out, wearing this denture that's basically made as a guess, and then at the 3-month mark, making that thing fit well. So that's kind of the procedure, but it's absolutely, that's a top plate, right? Bottom is even worse. It's even worse. Anyway, so that's kind of the process. Does it kind of make sense?
Yeah, that makes a lot of sense. If that doesn't scare our listeners into looking after their teeth, I'm not sure what will. Maybe the price, if we had that on top, $5,000 per.
Absolutely. But
tooth.
I mean, look, there is, if you're going to get a full arch of implants, your whole top teeth done, it's not, $5,000 a tooth. It'd be significantly less than that. But irrespective, let's go with that because it's the reality of how good your natural teeth are. And even implants, as good as they are nowhere near as good as your own thing.
All right, Leif, thanks so much. Bloody scary topic, but very interesting. I do get asked that a lot about, I'm sure you get asked much more. But thanks for coming onto the show. For our listeners, please be sure to follow us on our socials, download the bloody Pearlii app and get a free dental checkup, and catch the next episode. Thanks, Leif.
Thank you very much.